I'm Gary Goldstein, and I'm the Director of Transplant Service Operations for Stanford Healthcare. Well, I signed up for the Be the Match registry and within 2 years was asked to donate bone marrow. So it was exciting and thrilling, and the staff at Stanford treated me like a VIP. I had no qualms about proceeding. I knew how important it was for a patient and just felt extra special to be able to help patients in yet one more way. And this was another way to try to literally give someone a new chance at life. I've worked with the NMDP in many ways, but advocacy is something that I feel strongly about because I've seen the difference that we can make by getting laws passed that benefit our patients. And I've seen science expand, I've seen donors benefit, and I've seen patients benefit all through the work of our federal government, but it takes advocacy to make that happen. When I think of my most meaningful moment, it's not one where I was actually doing the advocacy, but it's something that drives me when I'm being an advocate. And I got to see a young boy who was a transplant recipient and his parents meet his donor. His donor was a lieutenant in the Navy, active duty, and while on active duty serving, he was wounded and received a Purple Heart. At their first meeting, the donor gave his Purple Heart to this young boy, telling him that he fought a battle so hard and was so brave that he deserved to have the Purple Heart. And it was very touching, and it always reminds me of why we do this every single day. The best part about being an NMDP advocate for me is knowing that we're making improvements for patients not just today, but for the future. Advocacy is one that I can do, that frankly anyone can do, and it still helps our patients, and it helps the mission, and it helps save lives.